Well, we've been talking about this one all afternoon. In a special health check report tonight, there's a brand new procedure on the market that's allowing some people who are considering plastic surgery to postpone going under the knife. Barbara Moore-Silva has more.
Look at the lips, and I see the changes that have happened since that time.
It's amazing how fast 20 years flies by. Just ask Carol Geegan, who was in her early 20s when the picture on the left was taken. She compares that to now.
My lower face is getting a little deflated as I'm aging.
And her lips aren't as full, but Carol isn't looking to do anything drastic.
What we're always doing is looking for sculpting agents or things that can be anti-aging to try to help people look their best and not have to go to the operating room in order to do it.
What Carol is about to undergo will take minutes, not hours, a little numbing, and a needle filled with something new.
The substance is a hyaluronic substance. It's like glucose. It's like a sugar, and it's natural occurring in everyone's body. So you don't have to do a skin test. You can just inject this right off the shelf.
The substance, the new FDA-approved injectable gel called JUVÉDERM.
The whole lifting idea started years and years ago, decades and decades ago, but that was only one dimension because the aging process is more than just sagging. It's also deflation.
JUVÉDERM reinflates.
With Carol, what I wanted to do is help her with this deep, with the fold that she has here between the cheek and the lip, also with a little bit of the downturn that is present here at the corner of the mouth.
One room over, Kelly Lambrisi is getting nice and numb for her JUVÉDERM injections.
Well, my skin when I was 21 was just beautiful and even though I did have some creases around my mouth, they weren't as significant. So I just want to, slow the aging process but look as natural as possible.
Dr. Sullivan uses Kelly's picture when she was 21 to get an idea of what he needs to do.
She has a deeper fold here on the left side and another one right here. It is a much different shape on the right side, but a second fold here. And then there's a fullness that is just in this region. Very difficult to work around this because you don't want to put any filler in something that's already too full.
Not only are patients numb during these injections, a cooling agent is used to help ensure there is no pain.
Did you have any pain?
None at all.
Exactly 1 week later.
Kelly!
Hi!
How are you?
Kelly is a little more than pleased with the results.
People asked me, said something looked different about me.
Her results, though, not immediate, but over several days.
I started to see things fill in and the lines not be so deep, and the corners of my mouth, if you remember, were downward a little bit, so I noticed them coming up. Every night that I went to bed, I couldn't wait to wake up in the morning and see the change. I could see it every day.
We were able to fill that out, try to get the sides to be more symmetric. Carol!
For Carol, the first few days after her procedure,
It was puffy. It was swollen. It was swollen for a good 2 or 3 days.
Carol is talking about her upper lip. By day 5,
It looked very normal and just full, and it didn't hurt anymore.
Carol says it's what she'd hoped for and more.
It's very subtle. It's nothing dramatic. I don't think people would really notice it unless I said, hey, look what I did.
JUVÉDERM is very new, hitting the market the first week of January. Dr. Sullivan says it costs between $700 and $1,000 per treatment. And he says the effects of each treatment last about 6 months and can be and often is combined with Botox for even better results. And remember, this isn't something just any practitioner can do and do well. It takes skill. So make sure the person who's doing this procedure knows what he or she is doing. For more on JUVÉDERM, you can log on to turn10.com and click on health. With this special Health Check 10 report, Barbara Moore-Silva, NBC 10 News.